Before we get any fiscal support, we are going to probably be getting a vaccine, possibly in the next couple of weeks with emergency authorization. What's the plan? Who gets it first in New York? How quickly will it get rolled out?
I think your last question is the most important. I hope we, to reverse your question, I do hope we get a stimulus plan before the vaccine is widely available. We don't expect there to be mass inoculation of New Yorkers until 6 months from now. We will start with the healthcare workers, the frontline workers, those who are vulnerable, the senior citizens, communities of color that are having infection rates at much higher than the national average for whites. The communities of color, black and brown, are really being harder hit. So we have a plan that Governor Cuomo and our team have been working on literally since July. We have a Nobel Prize winner heading up our efforts to ensure the safety of the vaccine, along with what's going on at the federal government. But we will get it out to New Yorkers as soon as humanly possible, the second it's available. In fact, the governor has said we'll have the most robust distribution plan in America. That all being said, this is not the save-all. This does not allow you to go around without a mask and say, well, I'll get a vaccine, I'll be fine. That vaccine is not going to be widely available for months. And so we're going to have to adapt to it. And we'll need that money before that's available.
So, Lieutenant Governor, you've got a plan that you've come up with for the state of New York. Can you walk me through whether there is a plan at a federal level and what the discussions between the state of New York and the federal government actually look like right now?
Well, yesterday, the governor has asked me to participate in a call with the White House with other governors, and there was a very aggressive plan. We talked about our role in that in terms of the distribution, and they're working on this closely. So we are in partnership with them. We have to be. We're not going to, just because it's still the Trump administration, not work with them. Of course we're going to work with them. It's great to know that they're working aggressively. But we also know that as soon as Joe Biden takes over, January 20th, I anticipate that there'll be an understanding that the Trump plan as it stands now is focused on, yes, they've identified populations that should get it first, but also their plan does not take into consideration the fact that most people do not have a pharmacy or a doctor readily available to them. Look at our most densely populated urban areas. There's not a CVS, a Rite Aid, or a Walgreens on every corner. You see that in wealthier suburbs. We don't have that in rural areas. So to expect that people are going to be able to go to a doctor easily and also be able to go to a pharmacy to get it is merely unrealistic. So in New York, we're going to make sure that we engage the churches, the community centers, the senior housing, the congregate setting sites. So we're going to be drill even deeper down into the distribution that is being offered by the federal government. But as I mentioned, our communication was as recently as 24 hours ago. So it's ongoing.